Welcome to this Friday's webinar. If y'all haven't noticed, if you've attended the previous webinars, we've been covering a lot of areas within lifestyle interventions and health in general. And the idea is within the Theriome test. So Theriome is a multi-omics company that sells, well, we're offering several multi-omics tests at this point, but our main test is a metabolomic test. And part of the metabolomic test, from looking at the metabolome, we are doing various recommendations. And the recommendations are diet related, nutrition related, supplement related, and lifestyle related. And one thing we identified was that not all practitioners are comfortable with making these recommendations. And so one of the things that we aim to do with this is to have a series of webinars where we're giving just some foundational information when it comes to some of these baseline recommendations. And so the past 3 or 4 weeks I had several webinars on nutrition. There's a lot of information there in terms of subjective information, objective information, labs, conventional labs, metabolomic labs. We also covered supplements last week, and we looked at just some foundational things about recommending supplements, assessing supplement intake with patients, and then also how supplements can impact metabolic pathways or how to look at metabolic pathways to make certain supplement recommendations. This week, and let me introduce myself, I am Dr. Greg Nacarelli. And so I'm a naturopathic doctor, I have a PhD in genetics, and I'm a precision health consultant and clinical success manager at Theriome. And my goal ultimately is to combine natural medicine with omics to improve precision and personalization with medicine, which is sorely needed in this day and age. And so this week we will be covering lifestyle medicine. Now, lifestyle medicine encompasses many different areas, and we've kind of touched on some of these already, but the main areas I'll be focusing on today are exercise, stress management, and sleep. So sleep, roughly 1/3 of people in the United States experience some sleep-related issue. I'm going to guess that's probably even higher than when that was originally tallied. So poor sleep is associated with many different health issues, chronic fatigue, inflammation, irritability, impaired concentration, and overall increased risk of death. If you had to ask me would I rather be sleeping too much or too little, I'd rather sleep too much because a lack of sleep is just skyrocketing for so many different health issues, depression, anxiety. If you are a late night worker or a shift worker, that's going to increase your risk of sleep impairment. Excessive light at night, traveling across time zones, this could all disrupt our circadian rhythm. When you look at how much of this is due to genetics versus how much of this is due to lifestyle things, such as our environment, our stress, insomnia is roughly 40% genetic, which means it's roughly 60% due to non-genetic causes. Restless leg syndrome, another common issue frequently experienced with individuals, 60% of the time that's due to genetics. And then sleep apnea, 25% of the time it's genetics, which means 75% of the time sleep apnea is not due to just some random genetic phenomenon. It's actually due to our diet and our lifestyle. So abnormal sleep, I briefly mentioned this. If you have insomnia or any other sleep-related issues, you are at increased risk of high blood pressure, cardiovascular disease, obesity, diabetes, GERD, kidney disease, asthma, accelerated aging, neurological diseases, and just overall increased risk of death. So it's a big one. Amy, I see you're just jumping on. I do have it under control, but if you want to stay, feel free to stay. But we're good. So sleep assessment. So in a patient visit, you need to assess for sleep every single visit. So on an intake, what things are you looking for with sleep? You're looking at duration, awakenings. Do they have segmented or polyphasic sleep? How long does it take for them to fall asleep? Do they stay asleep? How is their sleep quality? Have them score it. Are they dreaming? Do they not dream at all? Is their sleep restful? I like to grade it on a scale from 1 to 10. When you wake up in the morning, how much energy do you have? A 10, you're jumping out of bed with bountiful energy, and 1, you basically can't get out of bed. Score this every time. And a trick when you're doing scaling questions is always to try to get more information. So if they say an 8, say, okay, why not a 9? Why not more? And then there's always some level for improvement. So just try to get them to give you some metric. And this way you're tracking their response. I can't tell you how many times somebody will say, how is your sleep? Well, it's poor. I have them score it. And the next week they say, oh, it's the same. And I'm like, how would you rate it? And then they rated a higher score. And I said, okay, well, it looks like you're doing a little bit better than last week. And they're like, huh, I guess I am. Ask them about pre-bed rituals. Do they have a lot of light exposure at night? Do they have a lot of cell phone or computer usage at night? Are they watching the TV? Are they watching a movie? Are they doing things that is keeping them awake? If you want a more standardized sleep assessment tool, there's the Pittsburgh Sleep Quality Index that you could use. It's a standardized form to assess for sleep. I am a fan of sleep biometric tracking. And so you could use a various device. There's wristbands, there's a ring you could wear, there's headbands. I don't want to recommend particular brands, but there's many options on the market. What these are doing are tracking our biometrics. And so things like heart rate, resting heart rate variability, oxygen saturation, and body temperature. So all these things, you'll see shifts. One quick story, when the first time I had COVID, I was using I was using the Oura Ring. I was using a biometric tracker. And about 3 days before I had any symptoms, I was looking at my biometrics and I noticed my deep sleep was decreasing, my body temperature was increasing, and just my overall restfulness score was decreasing. And I'm like, what the heck is going on here? Why is all this? And I was looking at the entire trend. And then sure enough, on the third day, I started getting the symptoms. I'm like, oh my gosh, like my physiology was already changing before I even actually felt it. So it's pretty interesting from that regard. These are just general biometric scores. I'm going to talk about stress later. You could absolutely look at these for stress as well. When it comes to sleep, devices can track the amount of wakenings you've had, separating light sleep from REM sleep, from deep sleep, from total sleep. Some devices will calculate a sleep efficiency score or a readiness score. And so there's many different types of measurements. What I'll say is I wouldn't necessarily switch between devices because I don't know how well they track between devices. But if you're sticking with one device, it's generally pretty reliable for certain things. I don't know, like there's controversies. How well is it distinguishing like REM sleep from deep sleep? That's, I think there's different opinions on that. But I like it for especially looking at the timing of sleep. The awakenings, I find it useful. And patients can share this information with you. I will have an area on my intake form where they could input this data, especially the deep sleep being an important one and sleep duration and whatnot. Blue light and circadian disruption. This is I think, an under-discussed area, at least within the conventional medicine field. And I think a lot of more alternative medicine practitioners are discussing this. We should get blue light exposure during the day. Right now, the sky outside is blue. So if you walk outside, your eyes should see a blue sky. This is when our melanopsin, which is going to be absorbing these, it's going to be part of this circadian rhythm pathway that's going to be regulating our sleep cycle. The blue light exposure during the day is going to improve our alertness. It's going to improve our mood, improve our productivity. It's going to support our daytime functioning. It's going to help our brain to make melatonin, not release it, but produce it. Now, as it gets dark is when we start to release melatonin. But if we are exposed subsequently to blue light in the evening via artificial means, and I find this so fascinating. I really like this graph. So if you look at the spectrum of sunlight, it's a whole spectrum of light. Depending on the time of day, some parts of the day, there's more blue light, more red light. If you look at an incandescent lamp, it's actually more red, less blue. If you look at a fluorescent lamp, it's a little more green and orange. But look over here at your LED lights, especially monochromatic LEDs. You get big blue spikes. And then we have our white LEDs or our cool white LEDs. You ever be driving down the road and you see your light flashing before your eyes because you're hit with this bright light? The lights that are used nowadays are just these super powerful blue light LEDs. This is, and also in the United States, as of I think it was last year, incandescent light bulbs were banned. So the usage of blue LEDs or cool white LEDs are just very high, which is leading to circadian disruption. So with a lot of exposure of blue light at night, you're suppressing melatonin production, you're delaying your sleep-wake cycle, you're reducing your sleepiness, and just your sleep quality and quantity is going to decrease. So not a good thing. I thought this was a very interesting study. So they actually had teenagers that used devices at night, and they gave one set of teenagers a pair of blue blocking glasses, and then they gave another, not a pair of blue blocking glasses or just regular glasses. And they measured salivary melatonin. And what they found was that this is the blue blocking glasses group. This is not. The group with blue blocking glasses had higher melatonin secretion than if they weren't using blue blocking glasses. And this was with them still using devices. So use blue blocking glasses. It's not just a fad where it's just some, gimmick thing. Like it actually, by decreasing blue light exposure at night, you will have more melatonin production. Why is that important? So melatonin does many different things. It's not just for sleep. It's an antioxidant. It's anti-inflammatory. It's cardioprotective. It's anti-Alzheimer's. It's antidepressive, neuroprotective. It helps with blood sugar regulation. Our pancreas will be interacting, or melatonin will be interacting with the pancreas to help set our blood sugar point at night. It's anti-cancer. It's just super important. So this is something we don't want to forget. But also remember, this is melatonin. We need to get light exposure during the day in order to make sufficient melatonin. So just some general sleep hygiene things. Try to go to bed and wake up at the same time every day. Try to get bright, natural light in the morning. Avoid artificial light exposure at night. Consider blue light blocking glasses and incandescent light bulbs, and especially try to avoid blue light toxic lighting, especially the cool white LEDs. Diet is important. So higher protein intake is going to have a more blood sugar stabilizing effect, and it's going to help regulate our circadian rhythm. So one thing I'll see with people with dysregulated sleep is they're having too much glucose, too much carbs, too little protein. So make sure that is accounted for. Make sure someone is active during the day. Sometimes people, they say they can't sleep and they feel restless at night. And then the question is, were you active during the day? And so make sure they're moving so they get tired. Avoid stimulants later on in the day that could keep people awake. Me personally, some herbs I like for relaxation: passion flower, skullcap, lemon balm, lavender, chamomile are excellent herbs. There's relaxing herbs, then there's sedating herbs. So herbs for sedation, these have either GABAergic activities or calcium channel blocking activities. Well, actually, these have some calcium channel blocking activities as well, but valerian, kava, wild lettuce, great herbs for that. And then cortisol is also part of this pathway. So another thing you'll see with impaired sleep is these cortisol spikes, especially at night. So some of my favorite cortisol lowering herbs are holy basil, magnolia bark, which is part of this combination of herbs with phenyldron called Relora, which is awesome. I really like it for helping with sleep and lowering cortisol or just stress in general. Ashwagandha as well, another herb that could help lower cortisol. With our food intake, so getting into the metabolism during the day, especially during a fasting phase, our metabolism is having shifts. So we're in more fat burning and glycogenolysis, where we're breaking down glycogen for fuel during the daytime. And then at nighttime, we're more in fat creation and we're more in glycogen production. So there is two different phases here for our metabolic function during the day. Nighttime eating is very horrible for our metabolic health. So it's associated with atherosclerosis, metabolic syndrome, weight gain, obesity, high blood sugar, hyperlipidemia. And this is going to be affecting it's going to disrupt our signaling for our circadian rhythm, especially if we're eating late at night. And so we're going to see declines in some of our hormones: leptin, ghrelin, melatonin, cortisol is going to be dysregulated, especially if we're eating late at night. And this is going to alter our energy expenditure intake. So a lot of people, they have excessive eating and they kind of can't help it. One thing to fix is their circadian rhythm, because that being off is throwing off their food cravings, which is subsequently increasing their risk of disease. What is happening to our metabolome during sleep? This was a fascinating study. They literally hooked someone onto a detector for what phases of sleep they were in. And then as they were exhaling, they were measuring their metabolites to see, okay, while they're in what stage of sleep, what is happening with their metabolism? And so what was interesting is that while somebody was in REM sleep, rapid eye movement, their glycolysis and TCA cycle were increased. Whereas when they were in deep sleep, that's what they're calling N3 here, there's more fatty acid oxidation. So it's interesting to see that during sleep, our metabolism is kind of shifting a little bit towards different areas. And so if you see these are disrupted, the question is, okay, how is the sleep impacting these? Because you want these to be functioning optimally, especially for restorative sleep. Chronic sleep disruption, there's lots of mechanisms that are associated with pro-cancer activity. DNA damage pathways are dampened. We have excess sympathetic nervous system activity that is increased. Blood-brain barrier disruption, that's another thing too, is that as our blood-brain barrier gets disrupted, we're going to be more susceptible to environmental insults and brain inflammation. I'll be talking about the chironic acid pathway in a little bit here, but that will also be affecting blood-brain barrier disruption and subsequent brain inflammation. And then obviously our metabolism is going to be altered, being more towards hyperglycemia, insulin resistance, immunosuppression, elevated cortisol as well. So metabolites that are associated with insomnia, looking at that other graph showing that, okay, we have TCA cycle metabolites. A lot of amino acids will feed into the TCA cycle. And so you'll see a dysregulation in amino acid metabolism in individuals with insomnia, gluconeogenesis. So that's one thing you'll see with insomnia. With sleep deprivation, it kind of changes a little bit to more fatty acid metabolism disruption. So sphingolipids, which are part of our cellular structure and help with intracellular processes, you'll see those are disrupted, and lots of different choline molecules as well will be disrupted in those with chronic sleep deprivation. Melatonin comes from tryptophan. And so in order to make melatonin, we need adequate tryptophan, well, intake in our diet. We need vitamins to help convert tryptophan to melatonin. And so you'll have tryptophan converted to serotonin. We need folate and B6 for this reaction here. Serotonin to be converted to N-acetyl serotonin, zinc and magnesium. And then we need methyl groups in order to help convert N-acetyl serotonin to melatonin. This is where our methylation cycle comes into play. So this is where methylation dysfunction can contribute to insomnia. And so for methylation, that's methylated folate. We need B6 for further conversion of homocysteine. B12 as well, methylcobalamin is important for that. We ultimately want enough S-adenosine methionine so we could contribute methyl groups to melatonin. And actually this molecule here, 6-SMT, sulfoxy melatonin, is something you could measure as well to extrapolate melatonin levels. I've seen tests where people have done this and it's off the charts, but usually it's because they have high, or they're supplementing with melatonin. But notice here, it gets sulfated or glucuronidated. So this is what's happening in the liver. So if these pathways are impaired, sometimes you have people, they say, I take a melatonin and now I'm groggy for the next 12 hours. The question is, what's going on in your liver that you cannot metabolize the melatonin properly? I'm willing to guess that they have some level of phase 2 impairment in their detox pathways where they're not sulfating properly, they're not using glucuronic acid properly. So that's one kind of thing I've seen there. GABA, very important for sleep as well. It's an inhibitory neurotransmitter. We make GABA from glutamate, which comes from glutamine. B6 is needed for this process. So for people with glutamate excess or glutamate sensitivity, definitely think B6. And this is something, again, a metabolite you could measure to assess for not just sleep, but other areas as well, especially stress and anxiety. All right, so some takeaways from this. Consider evaluating the TCA cycle, amino acid metabolism, and fatty acid synthesis for assessing for metabolic disruptions due to sleep impairments. Look at tryptophan metabolic pathways. Let me go back a second here. Tryptophan can go down this other pathway where it makes chyluronic acid, which is a more anti-inflammatory brain metabolite. And I didn't list it here, but it could also go down this other pro-inflammatory pathway called quinolinic acid. So two metabolites that you could look at is chyluronic acid, which is more beneficial anti-inflammatory, or quinolinic acid, which is more pro-inflammatory. People with sleep disruption, especially quinolinic acid, is associated with Alzheimer's disease and other neurodegenerative conditions. So sometimes you'll see people where they're not making melatonin and they're low in chyluronic acid, and what their brain is subsequently doing is going down this more pro-inflammatory pathway. High inflammation, high oxidative stress, high cortisol is going to promote the formation of quinolinic acid compared to going down this other pathway where you make serotonin and melatonin. So it's one thing to keep in mind. GABA, another one, important one. You can look at glutamine, glutamate, and GABA. And then there's other pathways that are implicated in this. Dopamine, special low dopamine being implicated in restless leg syndrome. That also plays a role in this. There's the orexin hypocretin pathway that also plays a role in this, in addition to other pathways that can affect sleep. All right, let's talk about stress. So stress is a response to anything that requires action or attention. It involves activation of the HPA axis. And so that's what we're looking at here. So basically HPA axis, our hypothalamus, is communicating with our pituitary gland. It's releasing its peptides here. We have adrenocorticotropic hormone releasing factor, CRF. It's communicating with the peptide gland, the pituitary gland, which is releasing ACTH, which will then be acting on the adrenal gland to release glucocorticoids. There's a negative feedback loop here. So the more this is released, the more it's inhibiting the hypothalamus. But this whole pathway is getting ramped up when stress is occurring. And cortisol I'll talk about in a little bit, but it's working to increase epinephrine and norepinephrine, which can have some good but some bad consequences on the body. Long-term stress response leads to depression, anxiety, cognitive dysfunction, insomnia, heart disease, immune dysfunction. And roughly 45% of the difference in stress response is due to genetics. So 55% of the time it's due to lifestyle factors. So when you're looking at a stress response, there's a difference between acute stresses and chronic stresses. Most of the issues come from when a stress response is chronic, that being days to weeks. And so initially, when you have a stress response, you're going to release noradrenaline and adrenaline. You're going to release glucocorticoids. But then over time, you're going to get into this sympathetic dominant state and you're going to have overall an impaired stress response from it being activated for so long. On the nervous system, it can have some benefits, improved attention, cognition, improved pain perception, but over time, you're going to get visceral hypersensitivity, somatic hypersensitivity, and ultimately impaired cognition and attention. On the enteric nervous system, we're going to see increased activation and reduced gut contractility, but then overall, we're going to, over time, we're going to be leading to vagus nerve withdrawal and then impaired gut motility. In the short term, for our immune system, we're going to have some histamine secretion, which is potentially not good. This is when you see somebody with their cheeks getting red when they're embarrassed, you have sympathetic nervous system activation and a histamine response. But over time, you're going to have basically immune suppression from a chronic stress response. On the gut, you'll see alterations in serotonin metabolism, and over time, you'll see mast cell dysregulation, you'll see immune dysregulation in the gut, and then intracellular permeability. And then on the gut microbiome, you're not going to, well, in theory, you shouldn't see quick changes, although there is that visceral sensation that we feel in our gut. So the question is, what are we feeling there? There's probably some communication that's happening from the gut to our brain. But over time, a chronic stress response is going to, through these other mechanisms leading to inflammation and gut impairment, motility impairment, it's going to lead to composition changes in our gut microbiome. So in assessing stress, one thing I will ask every single visit is rate your stress on a scale from 1 to 10, 1 being the least, 10 being the most, and whatever number they say, why is it higher? Why is it lower? Other things that could be indicative of stress, are they grinding their teeth at night? Is their sleep impaired? One question you could ask is not, do you relax or are you stressed? Because a yes or no is not totally helpful, but ask them, how are you stressed? Or how do you deal with your stress? Or how do you relax? It's a good entrance into talking about stress in their life. You could ask them about their support network. You could ask them about how their mental health, ask about how stress is impacting their life. Gut motility, that's another thing I'll see. People that are chronically stressed, their gut motility is decreased. Biometrics, all the other ones I mentioned, will be altered in response to stress. Heart rate variability is one of my favorite ones. It's just associated with so many different health conditions, and it's affected by many different things, but it's a really good canary in the coal mine when it comes to stress. And you'll see heart rate variability for people, especially when they're going through a stressful period, it will be suppressed. You want your heart to be able to variate between beats to respond to environmental cues, but when it's stuck at just one low level, that's not good. And that's like, just think of yourself like being tense. You're not able to relax and just breathe through something. So HRV, really good biometric. I like to track for that. There's the perceived stress scale. So if you want to administer this on your intake, you can. It just has various different questions associated with stress. So if you want to quantify it a little bit more, you can. You can look at conventional labs for stress. So if somebody is stressed with high cortisol, it will increase glucose over time. So you may see increased glucose and increased insulin dysregulation. HbA1c may be elevated. Magnesium deficiency associated with stress response, inflammations, CRP, erythrocyte sed rate. Cortisol is a big one you'll see that will be spiking in response to stress. This was interesting. They had to look at cortisol spikes. They did this test. They had 2 groups of people, and I thought this was genius. How can you, if you're doing a test or you want to do a study to test for a cortisol spike, what would you do to stress somebody out? They have them, when we have TSA agents, they have to detect guns coming through the TSA. They had these people try to sneak guns service checkpoint. Now, the TSA agent, they knew that this was coming, so it wasn't like, you go to the random airport, try to sneak a gun through. But the people that were sneaking the gun through, these were the people that were not sneaking the gun through, and they were not stressed, and these were the people that were. So I thought that was kind of genius. And that would stress me out too, because I don't carry a gun through the TSA, but that even stresses me out in general. So anyway, we'll see cortisol spikes with that. Cortisol spikes are part of our hormone pathway. You'll see alterations in DHEA sulfate, which will be elevated in response to stress. And you'll see alterations in thyroid function, especially reverse T3. You'll see that increased as we're experiencing more stress. So looking at metabolites, going through this pathway, we have our corticotropin releasing hormone from our hypothalamus, interacting with the pituitary, ACTH, going to our adrenal gland to make glucocorticoids, and then also epinephrine, norepinephrine. We also have norapeptide Y being released. And we're going to have all these mechanisms that are going to be elicited from this response. Our food intake is going to be altered, ultimately decrease food intake, but then a motivation to eat more palatable food. This is why when you're stressed, people crave more fats, more sugar, ultimately making themselves more unhealthy. In an acute stress response, we want energy to react to something. If a tiger's running at us, we don't want to have low energy state. So we want to break down glycogen. We want to make glucose so we could have energy to respond. We'll have stress hyperthermia in order to increase blood flow and get our muscles the nutrients that it needs. Break down fats for energy. And then, in the short term, we're actually going to be blunting fat creation because we want to burn energy for fuel, not create and store fat. Two big players in the stress response, epinephrine and cortisol. For epinephrine, glycogenolysis, gluconeogenesis, so creating sugar from amino acids, breaking down fat, elevating blood glucose, and then also having cardiovascular effects here. This is good in the short term, but this is where some people say, okay, if you're running on stress hormones all the time, your body will eventually break down muscle to use those amino acids liberated as a fuel. So if somebody is chronically stressed, this was one issue I have with like people that are in chronic ketosis. I will see them, their cortisol is high because their body is trying to create blood glucose levels that are sufficient. So they will be burning and breaking things down. And for these people, their muscle mass is lower, generally speaking. So that's one thing you'll see with epinephrine and cortisol as well. Protein catabolism is what I was just mentioning. Inhibiting glucose uptake by the muscle. It's interesting. We're going to see elevated blood glucose, alterations in immune function chronically. You see suppressed immune function and increased susceptibility to illness with people with chronically high cortisol, and also behavior alterations as well. Looking at different pathways that are going to be elicited from this. To make epinephrine, going upstream, we need phenylalanine, which gets converted to tyrosine, which gets converted to dopa, gets converted to dopamine, which then gets converted to norepinephrine and epinephrine. I covered this last week, so I won't belabor it, but there's lots of vitamins and minerals that are needed for this pathway. So from the practitioner perspective, for people that are stressed, make sure they are getting plenty of these nutrients, because when these are blocked, you're going to impair their ability to make energy. Looking from a metabolite perspective, you could look at the breakdown byproducts of these. You could measure these. So dopamine will be broken down to homovanillic acid, HVA, and then dopamine, again, going to norepinephrine and epinephrine, and will be metabolized by these enzymes, monoamine oxidase and COMT, will be broken down to VMA. So with some people, you'll see elevated HVA and you'll see suppressed VMA, which means there's some break here between their body's ability to convert dopamine to norepinephrine, epinephrine. And so then the question is, are they getting enough vitamin C? Do they have copper? Is actually one you'll see if people are deficient in copper, you'll see this pathway impaired. Methyl donors, do they have enough folate, SAMe, and magnesium? Gut dysbiosis can play a role in this as well. Some Clostridia metabolites can impair this conversion as well. So there's the impact of the gut in inhibiting this as well. This is actually pretty common though. I'll see this imbalance. Magnesium, I talked about it last week. It's super important for many pathways. I probably put NAD and FAD above magnesium, but I'd put magnesium third in terms of cofactors or prosthetic groups or just compounds that are super important for all our metabolic pathways. Stress depletes magnesium, especially having a cholecalcitonine response. If we increase urination, a lot of people, they're losing magnesium, let alone they're not getting enough of it in their diet, let alone they're taking diuretics that is making them lose magnesium. So it's so important. It's needed for our serotonin receptor function, needed for GABA receptor function. It's just super critical. So especially for stressed individuals, got to dose them up with magnesium. All right, so some stress management takeaways. So consider a psychotherapy or talk therapy for people that are stressed. Cognitive behavioral therapy works well for this. Spend time in nature. This is my personal way to de-stress. I'm not a fan of just sitting and breathing or doing apps. Some people really like apps, and that's fine. For me, I'll find a local park and I'll just walk around. And like 20 minutes in nature will completely alter your health state, your mind state. So it's super important. Relaxation techniques. Again, usually I'm working with the patient. What are you willing to do? Would you be willing to walk in nature? Would you be willing to try yoga? Would you like to do breathing exercises? Have you tried biofeedback? Usually there's something that they're willing to try to help with their stress. So once we've identified stress as something to mitigate, try to incorporate one of these techniques. And these are incorporated into the digital twinning. You'll see some of these recommended. In terms of supplements, I like theanine. It helps lower glutamate, which is an excitatory neurotransmitter, very calming. It also has vasoactive properties where it helps relax the blood vessels. really nice. Magnesium, when we're talking about calming, I covered all the different forms of magnesium a couple weeks ago, but for stress, I like magnesium glycinate. Cortisol lowering herbs, holy basil, relora, like I mentioned, which is the Magnolia officinalis, and phelandron bar ashwagandha as well. Calming herbs, skullcap, passion flower, lemon balm. Make sure you assess stress with patients every visit. Try to scale it on a scale from 1 to 10. Consider conventional markers as a initial survey into possible markers that will be imbalanced with stress. And then look at metabolic pathways that could be dysregulated in response to stress. Yes, their TCA cycle and their fatty acid oxidation may be altered, but with this, especially for chronic stress, you'll see alterations in cortisol, dopamine, norepinephrine, epinephrine, and GABA. And if cortisol is high, there's just lots of different things we could do for that. And again, going back to the diet as well, chronic high glucose and carbohydrate consumption is going to lead to alterations in cortisol. So if somebody's having a high carb diet and their blood sugar is increasing and their insulin is spiking in order to drop the blood glucose down, when our blood glucose gets too low, the way our body gets it back up is with cortisol. So you'll see this cortisol dysregulation in people with high carb and sugar, low protein consumption. That same process that throws off sleep is going to make people stress as well, which is another example of just fixing the diet fixes a lot of these issues with people. All right, last topic, physical activity and exercise. So exercise is any planned, structured, repetitive movement to improve health, whereas physical activity is any movement that is carried out by the body. I try to make a distinction between these two because sometimes you'll ask people, are they exercising? And they say, well, yeah, I walked up steps to work. It's not necessarily exercise. It's good. I'm glad you're doing that. You're being physically active, but it's not the same as doing a workout. I think here it's kind of give or take. If people are not at the point of exercising, getting them to move as much as possible is great. You know, we're familiar with studies looking at the amount of steps per day. 10,000 steps per day is associated with, I think, like 55% decrease in mortality. So just walking movement is excellent. So you always want to kind of nudge people to do a little bit more, a little bit more. If somebody is sedentary and you say, okay, you need to go to gym and work out an hour, they probably won't even see you anymore. But the next step is if you are moving, well, usually I get people to be more flexible first. So stretching, doing things that will just make their body more ready to exercise. And then when their body feels better, then they're more likely to exercise. So it's a stepwise process. When we're talking about exercise, the obvious question, do you exercise? If they are, how often are they exercising? What kind of exercising? At what intensity levels? If somebody is not exercising, always ask them about injuries. I can't tell you how many times someone is not exercising and it's not because they're just lazy. It's, well, I broke my ankle and it's never been the same since and I don't know what to do type thing. So always ask about injuries. For physical activity, ask them what kind of profession do they have? Are they very active during the day? Are they sedentary? Are they sitting most of the day? Are they standing? And this gives you a clue. Even just standing, you're burning calories versus just sitting. And so these are things you want to be aware of. What's their workplace setup? Is their setup ergonomic? So these are all things you want to address when you're seeing somebody. Exercising, extremely beneficial for health, arguably more important than nutrition or diet. So with exercise, we're going to see improvements in cognition, cardiorespiratory fitness, decreased risk of cardiovascular disease, improved metabolism, increased immune function, increased microbiome diversity, increased muscle mass, and strength, and muscle function. Just you name it, basically there's a decreased risk of disease in response to exercise. Comparing the metabolome, aerobic versus strength training. So you're going to see some different pathways upregulated. With aerobic exercise, you'll see fatty acid metabolism decreased. Branched-chain amino acids will decrease and tryptophan will actually decrease, but you're going to see an increase in basically the TCA cycle, protein degradation because we're breaking down muscle a little bit. Isocarnitines will turn over. You'll see similar things between aerobic exercise and strength training in terms of its impact on the muscles. For the liver, you're going to see a decrease in lipid metabolites, probably because you're burning fatty acids more likely during aerobic exercise. You're going to see alterations in glucose and glycogen metabolites as we break down glycogen in the liver. Then we're going to see our liver is going to be making subsequent amino acids to be used to help build our muscles. So you're going to see biosynthesis of amino acids for both types of training, alterations in glycine, serine, threonine metabolism for both of these. I'd say the big difference between these is the impacts on the bone are going to be greater for strength training. So for strength training, you're going to see decrease in bone resorption metabolites, whereas you're going to see an increase in bone formation metabolites over the long term. And on our adipocytes or fat cells, you're going to see decreased fatty acid uptake of lipid metabolites, whereas you're going to see an increase in biosynthesis of fatty acids and amino acids, whereas you're not going to necessarily see an increase in fatty acid upregulation in response to strength training. Strength training is going to be more fast glycolytic, so we're going to be prioritizing glycolysis, TCA cycle, whereas with aerobic exercise, you reach sort of a threshold where you could use more fatty acids as a fuel. So that's why you see some of these shifts here in these pathways. In general, you're going to see alterations in lactic acid and pyruvate metabolism basically everywhere in the body in response to exercise. Pyruvate is another one you'll see is going from glycolysis to the TCA cycle. Pyruvate is a crucial molecule. I covered that a couple weeks ago, but pyruvate dehydrogenase, so crucial. There's so many nutrients that are needed for that. Basically, almost all our B vitamins, especially B alpha-lipoic acid, is critical for that. So if you want to be able to take sugar and bring it to the TCA cycle to burn as a fuel, pyruvate is a big one. If those are not there, you're going to see increases in lactic acid. So that's where some people are measuring lactic acid, because if it's increasing, that means that there's not enough nutrients to take pyruvate down to the TCA cycle. There's also oxygen needs as well. If there's not enough oxygen is required for this process. If not, that's where you have lactic acid accumulating and building up, which it's not. It used to be just lactic acid is bad. It damages muscles, but there's actually some benefits to it as well. So it's a little bit of a double-edged sword. I think it depends on the type of person, the type of athlete, the type of training that they're doing. In highly conditioned athletes, lactic acid could potentially be beneficial. This is really interesting. So they isolated several individual metabolites that are associated with exercise and their roles. So 12,13-dihome is associated with thermogenesis. BIBA. I had not heard about this until about a year ago, but now they actually sell this in a supplement that you could take. This is something that our muscles will make, and it actually decreases inflammation as a metabolite. Alpha-ketoglutarate, another one that's kind of been recognized in the anti-aging community for its numerous different benefits. It's another metabolite that's associated with muscle health, specifically muscle hypertrophy, browning of the adipose tissue, basically all these metabolites, alpha-ketoglutarate, BIBA, beta-hydroxybutyrate, hyaluronic acid, which I talked about earlier today, and then lactate will contribute to the browning of tissue that's more mitochondrial dense tissue, which is what we want. Hyaluronic acid associated with decreased brain inflammation and subsequently decreased risk of depression. Just overall brain stimulation, all these metabolites are going to be contributing to that. Another one with BIBA is increases fatty acid oxidation and then preventing bone loss, alpha-ketoglutarate, and BIBA. And here is all these. This was from a study. They basically exposed these individuals to various different things. Looks like alpha-ketoglutarate, they saw this individual did a 26-mile marathon. They saw this was increased. For BIBA, looks like short-term intensive exercises, beta-hydroxybutyrate, 4 weeks. Wait, no, that's the mouse. Let's see. Okay, acute exercise, treadmill running. So it's been shown in mice and humans. One thing that was interesting is we talked about walking and activity. There's lots of metabolic shifts that are even just associated with something as simple as walking. If we look at the pathways involving at least one metabolite associated with walking ability in the elderly, things you'll see. So to no one's surprise, caffeine metabolism. You take caffeine, you're going to be more active. Makes sense. This is highly associated with it. But another one, arginine and proline metabolism. This is another reason why arginine is so important. Nitric oxide it's a neurotransmitter. It also helps with blood flow and vasodilation. So these are especially crucial for the elderly, making them more likely to walk. Here's arginine deorphinine metabolism as well. And then we have some fatty acid metabolisms. Here's NAD metabolism as well. Not that these are statistically significant, but I would say definitely arginine is a big one for walking ability in the elderly. All right, so some exercise and activity takeaways. So assess exercise and activity every visit. Try to get people to continually move up. If somebody you'll see with your patients, they know that practitioner wants them to be moving and exercising. And some people, they are good about it. Some people, they're not. Life happens. They can't do it. So acknowledge if there's setbacks, reaffirm that progress has been made, and try to get back on the horse for however much they can do something. Maybe they used to be able to go to the gym and now, they have a lot of upheaval in the household. So, okay, can you do a walk around the block? Can you do that? Okay, fine. So just get them to do just whatever minimum that they're comfortable with, but always try to make progress when you can. If you don't feel comfortable doing this, refer them to somebody. So personal trainer, I've had people, I am a personal trainer, at least I used to do personal training way back when. So I'm comfortable like creating an exercise plan for somebody with how they want to exercise. But if you're not, just there are many practitioners that can do that. But the idea is get them to somebody that could help them work through it. Simply telling somebody to exercise, they know it. They know exercising is good, right? So, but how do you elicit change or action? There's so many different ways to do it. It could be simple things like walking somewhere instead of taking the car, parking further away from where they want to go. That's why usually I try to get them to do it in steps. If they are completely sedentary, getting them to just walk more, getting them to sit less, getting them flexible. Anyone that has not done a workout routine, I usually start them off with massage therapy. So I'll have them go get massages at least once a month, if not more regular. There's something called, I think it's called like Stretch USA or something, where they could literally go somewhere and have somebody stretch for them. So just show up, get massage, get stretched. This way your body is more flexible to do the exercise. Nothing sucks more than when, somebody has been sedentary, they go to exercise and they pull something. So that's usually the step that I try to. And also, as their diet improves, they're more likely to have the energy to do exercise. So it's not in a vacuum. You're usually doing the diet therapy and the exercise therapy, and the supplements help with this as well. Looking at pathways associated with exercise, glycogenolysis, breaking down glycogen, converting amino acids to usable forms of energy into the TCA cycle, glucogenesis, fatty acid oxidation, TCA cycle, all these will be altered with exercise. And then these other metabolites that I mentioned particularly are associated with exercise, alpha-ketogluteric acid, beta-amino isobutyric acid, BHB, hyaluronic acid, beta-hydroxybutyrate, lactic acid. Oh, no, I'm sorry. This is BIBA, and this is BHB, lactate, and then 12-13-dihome. All right. So takeaways from lifestyle assessments overall. Assess sleep, stress, exercise, activity, every visit. Optimizing these can provide drastic improvements for the majority of health concerns. Seriously, a lot of people, they're in a rut. They are convinced that they know what's going on with their health issues, and they wind up identifying with their illness so much. But are they sleeping well? Are they stressed? Are they exercising? Try to make progress towards these with whatever health condition they have, and I guarantee the health condition is going to improve. Don't push it because you could ultimately make them worse, but gradually working up stepwise will have serious dividends, pay serious dividends. So yeah, make sure they have healthy habits in place for sleep hygiene, for stress coping mechanisms, and their exercise routine is good. And consider assessing metabolite pathways to identify areas of metabolic imbalances that can be affecting these lifestyle areas. So as I mentioned in the beginning, I'm Dr. Nacarelli. I work for Theriome. So if you want to schedule a consult with me to discuss our test, we have a metabolomic test, and just using it in clinical practice or giving it a whirl, you can use this link, which I'll put in the chat in a second, and I will open it up for questions and answer. So thank you so much, everyone, for attending. So let me put this in the chat real quick. All right, so go into the chat here. Can we have a copy of the slides? You should be able to get a copy of the slides. So this will be part of our practitioner onboarding. So this is in addition to other webinars. So you should get a copy of the slides, and also this talk will be uploaded to YouTube to review. So you will get it in some form. Are there physical explanations for the occasional paradoxical reaction some experience with valerian root with its seductive property? And Robert had responded here, variations in GABA receptor function. Absolutely, because valerian is going to be acting on the GABA receptor, so you have to consider what's impacting that. Also, are people on medications that are affecting GABA? That's another thing I'll see. Will alter how they respond to herbs that are also GABAergic. Okay, drug interactions, very next thing. Other sedatives, antidepressants as well. Dosing issues, underlying conditions, anxiety, ADHD, hyperactivity, counterreaction. Yep. Physiological, placebo physiological effect. Allergies where not all valerian is from the same source. Some valerian is contaminated. So sometimes you'll get just a not good batch. This is where it's important to make sure you're getting like high quality practitioner level herbs, because they could have other things in there. So great question. How are metabolomes of athletes and ultra athletes compared to the person doing average everyday physical activity, and how do their bodies process differ with respect to one another? That's a really good question. I honestly have I have had daydreams about this, like measuring the metabolome. I have never had somebody that was that peak of an athlete that I've been able to analyze their metabolome, but I would absolutely love to. But I'm going to guess the athletes, their fatty acid oxidation is probably incredibly primed. Their muscles, their myokines or exerkines, these are compounds that are secreted from our muscles, are probably just incredible. So yeah, I'm going to imagine all their glycolysis, their TCA cycle, especially those other, BIBA and beta-hydroxybutyric acid, alpha-ketoglutarate. I'm going to imagine those are great. There is something interesting though. Athletes don't live that long, at least like compared to non-athletes. So the question is, these people are peak physical condition and fitness. Wouldn't that lend themselves to living longer? But they actually don't. So the question is, why is that not the case? So balance is very crucial. And especially athletes are sweating, they're losing a lot of nutrients. And so is there chronic nutrient insufficiencies that athletes are experiencing from that? Is there something about exercising to that degree that it ultimately decreases longevity? So I think there's probably some element of this where there's not good long-term metabolic impacts of being an ultra athlete. Okay, we have a question here. What is the ideal time to exercise around snacks and meals, fluid intake, whether light or heavier cardio, weightlifting session? I think this varies. So if you look at metabolic function, our body temperature is warmer later on in the day. So I'm just more of an advocate of exercising later on in the day. You want to make sure you have sufficient glycogen stores as well. So I know this is counterintuitive to what it seems like the most. Well, I don't know. When I go to a gym at 5 p.m., I guess I would argue differently. But people that exercise earlier on in the day, I'm just not a fan of it because you're at a fast. But you're more likely to go in fatty acid oxidation. But I just feel like I personally just got not as good workouts because my glycogen is low and my body is cooler. But look, for some people, that works for them. Absolutely be physically active. I'll go for a walk when I wake up. I'm a fan of being active and going out, but for an actual workout, where especially something that's going to involve using glycogen, I will have had some sort of meal, and it will usually be later on in the day. I would say, so I usually do some sort of complex carb, whether it's an apple or a banana, maybe about an hour before a workout. There's interesting studies looking at fluid intake. Some people have suggested you want to be mildly dehydrated, and that has some sort of beneficial effect on muscle health going into a workout. Certainly don't be dehydrated, but this mild dehydration state from having excessive, I shouldn't say excessive, having high amounts of electrolytes, calcium, magnesium, potassium is very crucial for this. So, okay, we have another question here. Does walking or running X number of minutes after a meal, does that circulation boost result in greater metabolism of food consumed and net nutrient assimilation derived? I think it depends. First off, after a meal, your blood is in your stomach and then eventually it'll be in your small intestines. So I'm not too big of a fan of this being, especially running. Now, if your body has had time to digest the food, and when we say digest, it's now in your bloodstream. So when it's in your bloodstream, your body is deciding, am I going to store this or am I going to burn it? So I like if you're trying to not gain fat and you're trying to shuttle those nutrients, fatty acids, and glucose into your muscle, then yes, within I would say hour and a half, maybe 2 hours. It depends on the size of the meal. If it's a very large meal, I would honestly wait longer, but you will divert it from being stored as fat to going to your muscles. So that I'm a fan of. Yeah, it does depend on whether it's the carbohydrate content of the meal, the amino acid content of the meal. Like glucose will absorb immediately, generally speaking. So that is obviously you're gonna have those nutrients be absorbed more quickly than if you were to have like a steak. Then you're gonna have to break down the proteins, and then you're gonna have to do the conversion from the amino acids into the gluconeogenesis. So the meal consistency does have an effect. Patients who have deficiencies in B vitamins but unable to assimilate, overstimulated. Yeah, I think we had this question last week. So it's very interesting. So first off, not all B vitamins are created equal. There's different types. So then the question is, what kind of B vitamins is someone being subjected to? B vitamins, as I've shown, are crucial in so many different metabolic pathways. So if somebody's been deficient in B vitamins, it's kind of like, think of a factory. When you first turn the factory on, where is something moving along the assembly line? Where is there a block? So sometimes it's just getting the factory to go back online. Thanks for attending, Cindy. Sometimes getting the factory to come online, you'll hit these blocks. So that's a good, thank you. So that's a question too, is where is somebody along in this process? Do they have, it's not just B vitamins, do they have all the cofactors that are needed? Think about detox. What if somebody has a high environmental exposure? We're ramping up our metabolic pathways. Thanks, Rob. Okay, yeah, we should follow up offline. Thank you so much for that. So that's one thing I wonder with people that are quote unquote sensitive to B vitamins is their body starting to detox something and now they're feeling the brunt force of that because now it's getting liberated from their tissues to be promoted for detox. So that's another thing I wonder about too. Another thing, some parasites feed off B vitamins. So do they have parasites? Thank you for attending, everyone. And next week we will be doing medications and the metabolome. So again, thanks for attending, everyone, and I'll see you next week.